The News Day continues here on One News Now. I'm Charles Lejano. The Health Department has kicked off its community-based and catch-up immunization for children against several diseases. To tell us the latest on this, we have Greg Gregorio now joining us live from Caloocan City to give us more details. Greg, good afternoon. How many children so far have received their shots?
Charles, just 25 children aging 0 to 13 years old have received their jabs against various diseases in today's ceremonial vaccination during the kickoff of the community-based and catch-up immunization of the Department of Health. These vaccinations include vaccines against measles, rubella, tetanus and diphtheria, as well as HEPA and polio. Charles?
Greg, how do authorities intend to vaccinate children in the NCR? Are there plans of maybe going to house?
Charles, the Department of Health is living it up to the to various LGUs in the National Capital Region. For Caloocan alone, they are planning to group each 10 houses and then call them into a certain venue for the inoculation of their children aging 0 to 13. According to Director Gloria Balboa of the Department of Health NCR, the target is 15 days of continuous vaccination in the National Capital Region, and then rest for a couple of days, and then another 15 days of continuous vaccination, and then thereafter there will be twice a week vaccination for this routine immunization in the National Capital Region. Charles?
Greg, given that schedule that you just mentioned, how many children are they planning to vaccinate by this year?
Charles, according to the Department of Health, they are planning to vaccinate not less than 5 million children aging 0 to 13 this year, because according to the Department of Health, last year they have seen a drop in the vaccination coverage for ages 0 to 13. For 2020, the vaccine coverage of this routine immunization is only about 65%, and that is 3% less than 2019. According to the Department of Health, this drop in the vaccination coverage is due to many factors brought by the pandemic, such as the limited mobility of parents having their children vaccinated, or the fear of having their children being infected by COVID-19, and the diverted attention of the health sector for the COVID-19 response. Charles?
Yeah, Greg, so will this parallel inoculation drive affect in any way the planned vaccination for COVID-19 for children this coming Friday?
Charles, according to the Department of Health, this will not make an impact to the pilot implementation of the pediatric vaccination for ages 12 and above with comorbidities that will start here in the National Capital Region come Friday or October 15. Even Metro Manila Development Authority Chairman Benner Abelos said all of the mayors in the National Capital Region have agreed for the conduct of this community-based and routine immunization in the National Capital Region. They are targeting to reach at least 90% of the target population for this vaccination alone by the end of the year. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting to us live from Caloocan City. Presidential Advisor for Entrepreneurship, Joey Concepcion, is pushing for Alert Level 2 in Metro Manila. Concepcion told Agenda that COVID-19 cases in the country, especially in the NCR, are now on a downward trend. He called on the IATF to look into the data and ease the alert levels to allow the operation of more businesses.
The risk is clearly going down. So we have to push for alert level 2. And at the very worst, alert level 3, but bring up the capacities of the business establishments to 50% and bring the cinemas in, bring the spas in, and allow more businesses to come in.
Concepcion noted that the government's decision is crucial to save the fourth quarter of the year for businesses. He added that the additional revenues from the private sector would be a big help to the already fragile economy.
this last quarter is the last chance for our entrepreneurs to make it. They have a lot of obligations to the banks. They have a 13-month to pay this coming Christmas. And of course, they have families to feed and employees to keep.
A game-changing COVID-19 pill is now up for review at the US FDA, which is expected to lessen hospitalization by about 50%. Jen Kalimon with the story.
American pharmaceutical company Merck and Ridgeback Biotherapeutics have recently announced their application for an emergency use authorization for the first COVID-19 pill, Molnupiravir. The pill offers treatment to COVID patients with mild to moderate symptoms.
So nakikita na natin kagad na habang maaga pa at sisimula na yung sakit, doon maganda pumasok itong gamot na to para pigilin yung pag-replicate o pag-multiply ng virus para hindi na lumala. At wag sana umabot na mapa-hospital tayo. Siyempre na-hospital lang yung mga komplikado na, no?
Based on clinical trials, Molnupiravir can decrease hospitalization risks by 50%. Out of over 700 patients in the trial, 14% of placebo-treated patients either died or were hospitalized, while 7.3% of those who took the pill were hospitalized. 27 Filipino patients participated in the study, and Merck said the results were no different from trials conducted in other countries. Results of the trials have been submitted for review to the U.S. Food and Drug Administration.
No matter the geography of the person, kahit anong lahi man siya, halos pareho-parehong effect ng gamot sa mga different races.
Infectious disease experts and DOH vaccine expert panel member Dr. Ron Jean Solantes said the pill could be a game changer in the world's battle against COVID-19.
Why is it a game changer? Some of them are saying it's a game changer because the intervention earlier will also make patients lower risk for death. Okay, more or less lower risk for death because you'll not be needing hospitalization. You'll not be needing more closer monitoring and the complications.
As of now, Molnupiravir has not been given an EUA in the Philippines, but it can be accessed through compassionate use. Experts said the Philippines could have an advantage in terms of access to the drug and proper use, since there were Filipino patients in its trials.
We're very excited, of course, if the US FDA already gives approval for the emergency use authorization, because that would potentially trigger every other regulatory body tulad natin to start really looking seriously at whether or not pwede na tayo rin mag-emergency use authorization.
Merck is now in talks with at least 8 pharmaceutical companies for the production and distribution of Molnupiravir in other countries. Despite this breakthrough, experts are still encouraging the public to get vaccinated against COVID-19. Reporting for News 5, Jen Kalimon, We Are One News.
Victims of Typhoon Maring used social media to ask for help after the onslaught. Netizens also did their part to assist those in need. Mobile journalist Jacob Lazaro with the story.
Imagine getting stuck on your roof with most of your belongings submerged under 10 feet of flood waters. With no electricity and no help in sight, survivors of Typhoon Maring on Monday posted in social media their cries for help, and their voices were heard from hundreds of miles away.
Also, yung mga hashtags po na sikat, yung katulad na lang po ng hashtag RescuePH, doon po namin tinitignan kung may mga reports doon. Tinatawagan po namin isa-isa.
On Monday, the hashtags Cagayan needs help again, La Union needs help, and Maring PH trended in Twitter and Facebook. In their own way, netizens helped during the natural calamity by sharing or retweeting posts by stranded survivors in the hopes that this would reach proper authorities. This video by Laika Figure and her family was shared 11,000 times and viewed 340,000 times. And in less than 2 hours, her and her family were rescued. Online Bayanihan, an organization of mostly students from the University of the Philippines, actively looked for these posts and coordinated with local governments.
Ang social media is really pinaka-accessible ngayon. Tingin ko po, doon nagpo-post yung mga social media because people are really willing to listen. People are really willing to help.
In Twitter, it's become a familiar pattern. For example, the Office of the Vice President has already sent 2 rescue teams up north because of the cries for help. Kent Mendoza, Online Bayanihan, said social media has become a vital tool for aid and information in times of crises.
Minsan, yung mga nagko-call for help ay pawala na ng signal. Parang yung post po nila ay parang last call, parang last shout for help.
Monteza shared the best practices when using social media to seek help. First, follow all relevant pages of your local government to keep updated. Second, use the most prominent hashtags of the current situation in your post so it can be easily followed. Mobile journalist Jacob Lazaro, We Are One News.
Time now for a quick look at some of today's headlines. Metro Manila imposes shorter curfew hours starting today, from 12 midnight to 4 a.m. The camp of Manila Mayor Isko Moreno denies reports that he is the administration's secret bet. And Miss Universe Philippines charity Victoria Velasquez Vincent turns down an offer to represent New Zealand in the upcoming Miss Universe competition. And those are the top stories at this hour. Join us again later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.